the beauty of Alaska, in part, is it is a very sparsely populated state. I think we have about 700,000 residents in the state of Alaska. About 400,000 of those live in Anchorage. So you get off the beaten track very, very quickly in Alaska.
When we say rural, we mean you cannot drive there generally. It's off the road system. You have to either fly there or you have to take a boat there. And then occasionally in the winter, you might be able to snow machine from place to place. So people are isolated, and anywhere they go is expensive, especially with the price of fuel now. And that has been our dental program in Alaska, is an emergency program, where there's no dentist. You wait until you're in enough pain that you're required to go see a dentist, and that means getting on an airplane, generally. And it may be, even from a small village to a hub community, that could be $500 or $600. Into Anchorage could be $1,000 easily.
Every one of my patients is in a high-risk category, meaning they have a high rate of caries, they have poor oral hygiene, their water isn't fluoridated, they have poor diet. It's overwhelming. It's overwhelming. There's so much to do.
Clearly, oral health issues have changed for the tribal people of Alaska with the introduction of the Western diet. It's been very destructive to oral health.
Groceries are really expensive in our villages. Any sort of perishable kind of product is almost never available in remote villages. Any dairy products, if you see any at all, they're often past the expiration date. So people go to other things, and there's one bargain in the grocery stores in Alaska, and that's soda pop. And that's a whole nother part of this story.
There are 42 countries around the world that have one form or another of dental health aid therapist. We don't have it. We never had it. The U.S. doesn't have it. So the tribal health directors determined about 10 years ago that they wanted to have dental health aid therapists. So in 2003, we sent the first group of DHAT students to New Zealand to get trained. A total of 11 came back as trained DHATs. And today, there's 10 of them still practicing.
I first learned about the DHAT program when I arrived in Kotzebue. It was explained to me that they will be a mid-level dental provider that will be out in the village to help manage the patient flow and provide the services that the dentist can't get out to provide. Like I said, when I got here, I knew nothing about them. But it seems like a good idea at the time, and it still does.
The training program is a 2-year program, and those students are selected initially by the tribal organizations they'll be working for. And then when they get here, they have 5 days a week, 8 to 5. They start out a lot of classroom work. But we also get them started in the clinic as well. And by the second year, they've had to reach a level of competency on a specific number of services so that they can start seeing patients pretty regularly.
Well, out in the bush, the villages, there's a lot of decay that's going on. When I was growing up, there was a dentist that only came out probably once every 2 years, but I'll be there to help them. I think it'll be great.
Well, in Alaska, we have over 200 different tribes, and here in Southeast Alaska, SEARCH is our regional health facility, and we provide their medical and dental care to them. That's how SEARCH wants to utilize me. They'd like the dentist to go out to the field first and do the majority of the assessments and where their expertise is needed for any emergency situations, and then I'll follow up the week later with routine fillings, routine extractions, education.
The dental health therapist is very well trained. But I didn't know much about the program until I came here, and I've worked with Brian, I guess, for 5 months now. And I think his scope is not as broad as what a dentist's scope is. He He does basically restorations. He works on a lot of children, simple extractions, and lots of prevention. And that's a lot of what's needed. I think it's kind of nice to have someone from the tribe, you know, someone local that can maybe communicate with the patients, you know, more effectively than I can as an outsider.
For years, it's only been dentists providing these services, and now we have a whole nother level of providers just to meet the demand.
Guyana is about 90 miles from Kotzebue. It's you can get here with the small plane, boat, snow machine, dogs if you have them. It's hard living out in the village. You know, dentists don't want to live out here, and so with someone like me being out here, I accept the living conditions and all, and I'm able to travel to other places, and you know, you don't see the same things every day. There's different cases and different scenarios, and you have to think of every little thing. You have to be ready, and if I don't know it, I keep in contact with the docs in Kotzebue.
We go in and we make an appointment with Kim. We don't have to wait, you know, what month, what week, you know, is the dentist going to be here? We don't have to wait on all that.
It's getting better all the time because she's there willing to try and help people.
I love what I do, and I'm happy here. I'm able to live in my community and do what I love doing.
Improving their oral health is going to improve a number of things, whether it's their confidence or just them not being in pain. You have a 5-year-old child in school with a mouthful of rotten teeth, and they're in pain. How can they focus on school when all they're thinking about is their teeth?
If we can work with the communities on developing a solution like the DHAT, then that gets to them owning the problem, that they're the ones in their destiny to solve this problem. What about other community problems? Maybe they can address those as well. So it's a level of empowerment that I think is important to them. It's an opportunity for education of hope.
This is my home. These are the people I grew up with, are my culture, and for me to make a difference in somebody's life has been very rewarding, and I've never had that before.
Just to treat our people, help them, I'm grateful for that. That's what makes it okay and helps me to move forward and see what more there is for me.
This is a great opportunity for the people of Alaska. So I think we're just making history here, you know.